How's it going, guys? Medium difficulty question, immunology, step 1, 47-year-old man with cellulitis. Now, we're not trying to make the diagnosis difficult. In fact, this spot diagnosis is pass level. You have a warm erythematous region on a leg, arm, ill-defined margins, classically cellulitis, inflammation/infection of subcutaneous tissue, which is worse than erysipelas, which is inflammation/infection of the dermis, although erysipelas looks worse. It's described as fiery red or beefy red. It wouldn't change, even if you misdiagnosed, it wouldn't change the answer in this case, okay? But you got cellulitis in a patient who also has instability. So low blood pressure, is febrile. I threw in that he works as a plumber because skin penetration, e.g., if he's on his legs, can be the inoculation that leads to the broader infection. So what's responsible for the hypotension? Let's just hop through. Choice A, CD14, aka toll-like receptor 4, wrong fucking answer. So this is going to be the answer for gram-negative sepsis on USMLE. For example, a UTI leads to a pyelonephritis, patient becomes unstable/septic. So you're going to have the lipid A of LPS, lipopolysaccharide, that binds to CD14 on macrophages. The macrophages then release cytokines. Okay, so TNF alpha, I've talked about, is the cytokine you're going to choose for hypotension on USMLE. Interleukin 1 is going to be the cytokine you choose for fever. That's gram-negative sepsis. Wrong fucking answer. Choice B, CD20, wrong fucking answer. So CD20 is a receptor on B cells. The only thing you got to know for USMLE is that rituximab is a drug that inhibits CD20. It's a chemotherapeutic agent. Now they can take, actually they'll take it one step further. What they're going to do is tell you rituximab is given, which of the following could subsequently be seen in this patient? And the answer is bacterial pneumonia, and you simply eliminate to get there. It's a difficult NBME question on the surface. CD20 is on B cells. What do B cells normally do? They mature into plasma cells, which secrete immunoglobulins required for humoral immunity that is responsible for bacterial killing. So you could get a question such as that and you eliminate, you say, well, it's not related to viruses, etc. Okay, bacterial infection could be of greater proclivity if a patient has B cell dysfunction in the setting of rituximab. Wrong fucking answer. Choice C, MHC2 TCR, correct answer. This is going to be for when you have super antigen. So you can have strep pyogenes producing exotoxin A, or it can be Staph aureus producing toxic shock syndrome toxin, TSST toxin. In both instances, you're going to have that super antigen bridge MHC2 on the macrophage to T cell receptor on the CD4 plus T cell, and that in turn will cause the macrophage to release cytokines. So this is an important juxtaposition. In gram-negative sepsis, as I articulated, you're going to have the lipid A of LPS bind to CD14 on macrophages. Macrophages release cytokines. In contrast, in the setting of strep pyogenes, which causes toxic shock-like syndrome, which is what we have here, or Staph aureus causing toxic shock syndrome, we're going to have super antigen bridging MHC2 and TCR, and in turn, the macrophage will release cytokines. The USMLE likes that contrast. They can give you a 16-year-old with nasal packing due to nose bleeding following a car accident, gets shock. They ask you what's responsible for the patient's shock, CD14, toll-like receptor, wrong fucking answer. It's going to be MHC2 and TCR. They really, really like this for USMLE. Okay, if you've been following my content, I've made prior clips on this. Okay, I've talked about this stuff in my PDS. Let's just hop through the final answer choice here. IL-1, wrong fucking answer. As I harped on, this is going to be fever in USMLE. Someone's hyper pedantic. They say, well, IL-1 can technically cause hypotension. Not for USMLE, okay? So they really want you to know that TNF alpha is the main cytokine that induces hypotension. IL-1 is going to be fever. Wrong fucking answer. IL-6, wrong fucking answer. Okay, I mean, can induce acute phase protein release by the liver. It can play a role in osteoporosis, as well as IL-1. IL-1 is actually known as osteoclast activating factor, but IL-6 also has a role in osteoporosis. IL-6 can play a role in anemia of chronic disease. It's actually a low-yield cytokine for USMLE. Interleukin-6, wrong fucking answer. You know the deal. When to make more content, if you like my stuff, subscribe to my channel. Appreciate your time. That's it.